My name is Karma Harris, and I work with the National Association of Chronic Disease Directors, or NACDD for short. So the Reaching People with Disabilities Through Healthy Communities project is a pilot project funded through the CDC Disability and Health Branch. We're working with 5 states, and those states are Iowa, Montana, New York, Ohio, and Oregon, and 2 communities from each of those states, so 10 total communities. And we're really looking at the healthy communities work using a proven phased model to community change that we've used in the past, where we focused on new policies, systems, or environments to promote healthy eating, physical activity, tobacco prevention and reduction. And the only difference now is that their changes need to be inclusive to people with disabilities. Really, 1 in 5 of us has a disability of some sort, and if it's not now, it will be at some point in the future. And when you think about a community, that community should be designed and be oriented for anybody who lives there.
So I have a spinal cord injury. I can get around pretty good. The most important would probably be curb cuts and sidewalks that are easy to navigate. I'd say secondly would be parking that's safe, and thirdly being able to work with businesses to have accessible entries.
We're working with the City of Corvallis and working with some students at Oregon State University to do a really in-depth assessment, looking at the walkability, bikeability, looking at the sidewalks, looking at the street, to see what are some opportunities that we have to make it easier for people to get around downtown.
Before and after my disability, my awareness and understanding of the importance of inclusivity has totally changed. I had an awareness of it, but I didn't realize, I'd never had a lived experience of what a curb cut can do for somebody to live independently, or as independently as possible.
We are in Pendleton Community Park, and they have a 1-mile trail that goes all the way around this. So for me to be with my family, everybody wants to walk and I want to go with them, but after a few miles my batteries will wear down. Now I can stop here, charge up, just take this part here, plug it right on into your wheelchair, charge up your wheelchair. I can be included in everything because I'm not worried about having my battery go dead or anything like that.
The scope of the wayfinding plan itself is for the entire Helena Valley. A lot of time went into the color scheme for those individuals who have low vision, being able to have a color scheme that doesn't just all blend into the background. The size of the lettering, different sign heights was all part of the conversation of who we're serving and their needs.
So this indicates to all users that they're approaching Centennial Park.
Butte people are very loving and embracing. We're looking at accessibility issues.
Right now we're doing a 20-year update to our transportation plan. There wasn't enough in the plan about bikeability and walkability, and so we have really prompted that discussion before that plan becomes final.
If the sidewalk is too narrow, I will have to go out in the street in traffic. Once I think people are educated, they're behind trying to make things more accessible for everybody.
We are at Longlands Family Rec Center up at the climbing wall. We received this grant to make the climbing wall more accessible to people with physical disabilities. To the climbing wall, the only change that we made was adding holds that are much easier to hold on to. As far as any additional equipment, there's a lot of additional equipment involved, like pulley systems, anchors, modified ascending devices as well, that kind of go into making this whole thing accessible. We've had people come in that never thought in a million years they would be able to climb up this wall. And they're coming in now and thinking, wow, this is something that we can actually do. We can make this experience accessible to really anybody.
For many of the individuals that we are working with, this is life-changing. Our goal is really for them to come into, the gym or out on a walk in the community or into the grocery store and be treated just like everybody else is.
I grew up with my family and my friends telling me, you don't have a disability, you have an inconvenience. And that has always been my motto. I helped organize a campaign to get audible traffic signals, and it was amazing. It was right at this corner of State and Union.
Yellow lights are flashing.
I would say that I am a lot more independent with the cityscape because I don't have to worry about traffic lights, and I've always have been really bad at crossing those.
Okay, my name is Brian McLean at MBT Stadium in Syracuse, New York. With the new management now, we've been involving the accessibility of the stadium. We have seating plans so that families can sit together. We have the wheelchair accessible spaces, then can reserve the seats right in front of them. We also have striped the stadium, people with visual impairments. Good weather, there's nothing like going to a ball game and eating and watching the game.
We are here in Marion at Tallgrass Park, demo some equipment to make the community more healthy. So we brought out some adaptive bicycles, kayaks, water skis, snow skis, fishing equipment to demonstrate to the community, that everybody can get out and be active and that disability or age are not a restriction. The biggest restriction is cost of equipment, and that's one of the advantages of us. You can access equipment through our organization without having to make a personal investment.
So I was approached with the opportunity to bring in the bikes that we see here. My role in this was to get a policy through to the Board of Education and then to implement the program. And education isn't all about testing. There's the physical needs, there's the spiritual needs, there's the mental, emotional, social needs. And we think that we're helping our students develop those physical needs with the use of these bicycles.
A lot of local healthy community change is about relationships. This particular project in general has really, I think, touched everybody more personally in a way than the projects before. With this project, it's really meant a lot to me because I didn't know as much about the disability and health side. And now I kind of see my world differently, my work world, but also my personal world. And I look for these things now, and I wouldn't have done that before. And on one hand, I celebrate, and on the other hand, I sort of get frustrated at myself because we should have been doing this years ago. This should be a way of life. It's really neat to hear that when this project ends, their efforts are going to continue. Each of them have listed plans that they have for continuing their work with disability inclusion. They've all kind of adopted the mantra of when you create a healthy community for everyone, nobody gets left out.